We spoke to a panel of experts for their analysis of the Victoria lockdown, the Shadow Minister for Health and Ageing, Mark Butler, Professor Sharon Lewin from the Doherty Institute, and the Vice President of the Australian Medical Association, Chris Moy. Thank you very much to all of you. Every time there's been a cluster in Australia of recent times, it's come from hotel quarantine. Dr Moy, where do you stand on the issue of the way quarantine should be handled?
The AMA's position is that hotel quarantine has done us pretty well until now, but particularly with the deluge of cases that are coming from overseas and probably with the increased infectivity of the new strains, that really the breaks are becoming too often and pose too great a risk. Look, we need to shore them up as much as we can now, but in the medium term we do need to find longer term solutions, which include places like Howard Springs and those models which will take it away from the CBD and the risks that they pose.
There was a question asked at the press conference of the Victorian Premier today that I wanted to see if you could shed any light on, Professor Lewin, and it was why Victoria's had 4 significant lockdowns and a much more severe death toll than any other state.
Well, the death toll is directly related to the number of infections. So we had the biggest wave of 20,000 infections, more than anything across Australia. That explains the deaths. Absolutely no concerns around the quality of care, which I'm sure has been and will continue to be outstanding here. The issues around the lockdowns are entirely related to this situation at which there is spread. Lockdowns are needed as we've largely used them following the second wave as circuit breakers. Every state pretty much has used different forms of lockdown to prevent massive expansion. This is very significant numbers of people that are actually being contacts now, and once you reach a certain level, no system can really keep up with that.
Do you agree with Brett Sutton, the Chief Health Officer's take today that Victorian contact tracing is now A grade?
I absolutely do. I think what we can measure is how quickly contacts are being contacted, and the goal is to do it in under 24 hours, and I gather that's what's happening. I think what's happened in this particular outbreak is some movement of people in the community while they were infectious and didn't know they were infectious, and that's the situation that we're facing now when there are something like 150 sites that are being investigated. It puts on huge pressure on any contact tracing system.
Mark Butler, let me guess, Labor will blame the Morrison government, but every state does have the federal input in common. Every state has hotel quarantine, every state has slow vaccination, every state does its own contact tracing, but Victoria has unfortunately found itself in this unique position. Victorian citizens surely do have a right to feel pretty uniquely let down.
Absolutely. This is a very distressing time for Victorians, particularly triggering a whole range of emotions from last year, I'm sure. But remember, this is a product of a failure in hotel quarantine actually in my hometown of Adelaide. And over the last 6 months, we've seen 17 outbreaks from hotel quarantine that have impacted every one of our major cities across Australia. So it's not a particularly Victorian issue. This is a national issue. We've been saying for months now there needs to be a new quarantine approach. This is not working.
Professor Lewin, this morning there were 29 aged care facilities where people hadn't been vaccinated. We know that some have been done today since then. We know from past experience that those are the facilities in which people are the most vulnerable. How negligent is that situation and who is responsible for that?
Well, at the moment, it's the federal government that's rolling out vaccination in aged care. Those 29 facilities, I gather it's about 5% of the total, so that we have actually vaccinated a lot of people in aged care. The sooner we move on this, the better. It takes about 2 to 3 weeks for your immune system to kick in after a vaccination, so we've really got to move fast here to protect those that are most vulnerable.
Dr Moy, the federal government initially said that you had to wait 14 days between getting the regular flu vaccine and then getting your COVID vaccine, but now today they've said that's waived for aged care residents and it doesn't affect effectiveness. Can you help us understand that?
So the original decision was so that we could separate the 2 vaccinations to make sure if there were any reactions between either that we wouldn't get mixed up as to which one was the cause. So now, given the risk that's posed in the circumstances, it's reasonable to change the decision, because we want to reduce the number of contacts and we want to just get those vaccinations done as quickly as possible. So essentially, it's really taking into account the current risk-benefit. It's a decision which is absolutely reasonable.
Mark Butler, the AstraZeneca vaccine was pulled for under 50s in Australia when there was no community transmission of COVID. So on that data, the potential side effects posed by the vaccine were a greater risk than an Australian's chance of catching COVID. That calculation's now different because there is now community transmission of COVID, so it's possible that one's chance of catching COVID is greater than the probability of an adverse side effect from the AstraZeneca vaccine. Given that change, would Labor support making AstraZeneca available to under 50s who would opt in for it?
Well, Labor's position, as it has been right through the pandemic, is to accept the public health advice. The decision that the government announced was based on advice from the Technical Advisory Group on immunisation, and we followed it because it was the proper public health advice. So if they're minded to change their advice, then obviously we'd look at that, and our inclination would be to support it.
What do you think on that, Professor Lewin?
Well, first of all, I think that's a great answer, meaning that public health is not a political decision. It's a technical and expert advice, which is exactly right. It comes from the technical advisory group on how we best use these vaccines that are safe and also balance risk. The actual risk around getting COVID versus the risks around blood clots was based on an outbreak, on numbers roughly related to an outbreak that we had in Melbourne last year, about 2 per 100,000. So that's where that risk cutoff is. The risk, actually just today, additional data has come out on blood clot risk and age-related risk with the small numbers that we've had in Australia, putting at about less than 50 at 2 per 100,000 and greater than 50, 1 per 100,000. So there is an increased risk. Small numbers, meaning that there is some error there.
Mark Butler, Chris Moy, Sharon Lewin, thank you. Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.